Okay, today's June 6, 2013. We're here with David. And David has a diagnosis of very advanced prostate cancer with metastasis to the bone, a huge prostate that's filled with cancer. And he came to me in a tremendous amount of pain. And I first saw you on May 28th. Dave, do you want to tell us what the nature of your pain was when you first came?
When I first came here, it was that particular day I was here was maybe like a 9.
9 on a scale of 10, with 10
Yeah.
being the worst pain you can imagine.
All right.
So you came in with a 9.
And I had it mostly in my right hip socket, all the way down my leg, and focused right in my kneecap. And I could hardly walk. And everything I did to sit up or stand up or move, I had to grab on to objects like the chair. For example, like in this chair, in order for me to get up, the last time I was here, I had to do this.
I remember.
And I was like this to make a move, and then to walk to the door was effort, turn around and come back.
Well, let's see you walk to the door now.
Well, now, I mean, it just, it's like night and day. There's no, and I couldn't put my pants on or my shorts unless I had to grab onto something, and most of the time I had to sit down on a stool, lay my pants down and stick my foot in there and pull them up to get my pants on. And now I can put my pants on standing up and my shorts. And as far as walking or going anywhere, I can walk, I can drive. When I came here, I couldn't drive. My daughter had to drive me here.
Oh, and you drove here alone today?
Today, yeah. She's not
I
with
didn't know that. Wow.
Yeah, I only feel a bit of like raw feeling in there because I drove, and I can see that my right leg and foot is on the gas pedal. Had I had the pain on this side, probably wouldn't have felt nothing because my right leg is doing the work. But aside from that, I mean, I have no fear of like walking a distance or like, look, I can stand up on my own. Now, last time when I came here, if you recall, this is as far as I could go. Now,
Oh, my.
if you recall that,
I
was right here and I was struggling and in pain just to do this. And I'm all the way down to the,
You can get within about 4 inches of your toes now.
yeah, it's getting much closer.
You know, please sit down. I'm only sorry now I didn't video you that day, but I'm sure that to the viewer this will be quite believable.
Well,
I may post this on YouTube.
oh yeah, and my
Okay.
daughter's been astonished at telling people every day that of all the therapies I did, because I started off with massage therapy, I just couldn't take the pain. I was next to crying every day, it was so bad. And I went 3 days in a row to do physical therapy, massage therapy for an hour and a half each time. And I'd leave and I'd feel like, oh my God, the bricks of pain are off me. And as soon as I got outside, they start to come back. And by the time Angie would get me home, they were coming back throbbing. And then I couldn't sleep at night. I'd just be tossing and turning all night, restless sleeps because of that. And so consequently, I went from massage therapy to chiropractic to acupressure to acupuncture to hands-on healing treatment, and all of it worked for an hour or so, and then it began to come back. However, when I came here last week, not only did it alleviate it after you gave me, I don't know what you shot me up with, but you shot me with on both hips, and instead of coming back, it just slowly went away. And that was my next question: is it going to come back? Because everything else came back. So far, this has just gotten better every day to where
It's gotten better every day.
every single day it's better.
And you didn't get better instantly. It's just been
No,
getting better gradually, right?
Yeah, yesterday was the first day I woke up, and I was wondering if I was dreaming or not because I didn't feel any pain when I woke up, and I was thinking, am I just in a good position? So I put my feet on the floor, and all of a sudden it was like, there's no pain. Wow. So I did my exercises really carefully, thinking that I'm going to do something to aggravate and bring the pain back on. And no, I took my shower, I did everything, I ate. I went through my day thinking, this other shoe is going to drop anytime it's coming back and going to hit me, kaboom. It didn't happen the whole day. And then last night my grandson, okay, because I don't stay up this late, my grandson, Angie makes me go to bed at 10, right, to get more sleep. My grandson had a birthday. We left at 9:30 to go to a movie to celebrate his birthday. We didn't get back till 1. I went to bed. I got up at 6:30 this morning. No pain. I wouldn't be able to make that movie had I not gone through this therapy. Had it been a normal day, I would have just said, I can't go to the movie because I'll make you guys bring me home.
How's your energy level?
Oh, my energy went way up. That was another thing. And Angie's caught me a couple of times. What are you doing? I said, oh, I'm just sweeping. You're not supposed to do anything. Don't do that. Well, but I got to burn this off. I got energy now. So that was a good feeling, to know that it's there. Before, I'm dragging butt everywhere all day long, night, falling asleep, can't get my work done. I mean, I'm a guy that likes to work 18 hours a day, mostly on the computer, but, my head on the phone, everything. And I was only able to put in like maybe an hour and a half and then go rest and try to get out of the position of the nagging and gnawing pain in my hip and my leg. And I'd only get maybe 4 good hours in a whole entire day instead of 18. And now it's like I feel like I can just keep on going on. I ain't gonna put in 18 because you already told me not to burn up that many hours. So I should get 8 hours of sleep at least.
You need to get your 8 hours of sleep now.
So I'm doing that now.
I'll make a couple comments. First of all, with regard to your energy, phenomenal sign. If you're feeling better, your body's coming alive. And as I told you, we don't treat cancer, we treat you. I treat your immune system. I treat your biochemistry and the metabolism. I'm not after treating the cancer. The best part here is your pain is virtually gone. Now you ask me, is it going to come back? Well, I'm not God. I can't say yes or no, but the fact that the pain has each day gotten better, even though you weren't here, means that whatever is going on in your body is now beginning to come alive, and your immune defenses perhaps come alive and start to deal with the inflammation that the cancer is causing in your bone. Bone cancer can be extremely painful.
So that's where the pain's been really coming from, because it's like, why does it keep, like nagging and gnawing at me,
Because you had cancer in your bone, and bone cancer pain can be excruciating. It can be one of the worst things there is. The fact that it's better is a really good sign, in my opinion. It means that the cancer could be putting less pressure on sensitive nerves. Maybe your immune system is coming alive and regressing the cancer and the inflammation and the swelling that's around the tumor. That's really my goal. If you recall, I didn't promise you that I could fix your cancer. It's not up to me to fix it anyway. It's up to God.
Right.
But I did tell you that almost certainly you will have a better quality of life.
Well, I'm a believer that, like what you said, my body is healing me. But if my body is beaten down and my immune system is down, there's no way it's going to heal me. And then if I'm not eating correctly, that's another problem. I'm not sleeping enough. That's another problem. And everything adds to it, and it just seemed like a downhill slide, to like destruction. But now I feel I went the other way around. When I went to Kaiser, it seemed like everything they wanted to do was to add to that stack of bricks with more stress, more, things like antibiotics that already started working on me and destroyed my digestive system. And I didn't have an appetite, therefore no energy, so it just seemed like, I'm just going downhill fast. And that's when Angelina looked up on the internet, saw you, and said, Daddy, and we got to go talk to this guy. We got to see him. And I said, well, I don't have the money right now. She goes, I already paid. I'm calling him up, and me and you got a phone, appointment with him. So that's the time we talked to you. It was good, and then we saw you on, I guess, the internet, and she showed me the whole program. So then when I came here, I didn't know what exactly to expect, other than that there's something new, or, it's not drugs, it's not antibiotics.
Not drugs, not antibiotics, not chemo, and it's not even hormones.
I just like the fact that it's my own blood that's super energized with oxygen or ozone, whatever you call it, that's doing this to me. And then when I've got the injections in my hip, the days that you weren't here, on the opposite days, it seemed like, I guess that's working too. It's just all adding up to, removing the pain and just making me feel more energized.
The injections in your hip is called minor autohemotherapy. That's where we take some blood, shake it up with ozone gas, and re-inject it. It's sort of like a vaccine. The purpose of it is to stimulate your immune system. once again, I'm not treating cancer. I'm trying to help your immune system come alive, and then your immune system hopefully will do what nature designed it to do. To me, cancer is a major failure of the immune system. It can't see it. So maybe if we treat your immune system, and that's all I'm treating, is your immune system, maybe then if it can come alive and it can do what it's supposed to do, then you'll have a fighting chance. And in 9 days, your pain has gone from 9, incapacitating pain, where you couldn't do much. You could hardly get on your clothes. You're now living a normal life in just 9 days.
Right. And that's like amazing. The other day I was telling you that I went out on the deck and my wife came out there, looked at me, and she goes, "What are you have this big old smile on your face. What are you smiling about?" I go, "This morning I woke up and there's still no pain." And I put my arms out and, oh, dude, it's like, what a good feeling.
Thanks. Well, it makes me feel good. I promise you, it's the most meaningful to you. And your wife is next, but I can tell you, I'm a really close third. Probably second, because, you know, I'm here in the thick of it with you. So thank you, and thank you for allowing me to post this. I'd like to continue videoing you and your progress.
That's fine with me.
Thank you. Oh, by the way, what was your PSA?
I don't know. Did you see that in my chart? Was it on that thing? It's like